Dennis Locks, Sports and Regenerative Medicine. We're going to talk today about hip AVN. I get a lot of patients from around the world with avascular necrosis. This one was an equestrian, and trauma is the leading cause of avascular necrosis. And obviously a fall from a horse is a form of trauma. If the blood flow is disrupted to the hip, this can cause bone cellular death, which is why the name avascular necrosis is there. Avascular means loss of blood flow, necrosis means bone cellular death. We can see this very easily illustrated on an MRI of the hip. The hip is a ball and socket joint, so the top of the big thigh bone is the femur, and it articulates with the pelvis, and you see that it should be a nice circular ball structure. And when you have avascular necrosis, there's an area that becomes darkened and blackened, and this is where the necrotic area is. And so this is what avascular necrosis looks like on an MRI. You have a lesion that is reflective of the bone cellular death. People are turning to regenerative medicine because they're looking for options to hip replacement, which is one of the most commonly recommended procedures for people with avascular necrosis, because in traditional medicine they don't know what to do with it. So stem cells and regenerative medicine have been groundbreaking in this, is that if you can help repair this, and we've had some very young patients and teenagers who were athletes, that we got them better and back to sport. They got college scholarships. So it's a very unique tool that we have now available, because it wasn't there before. And some really great athletes like Bo Jackson, who traumatized his hip in a football play where he was tackled, his hip developed avascular necrosis, and he never was able to play football again after he had a hip replacement. So preventing a hip replacement in cases like this is our goal with regenerative medicine, and it is a very worthwhile goal, especially in the younger patients, to prevent hip replacements. Thank you.